Good morning, I'm Dr. Jones. Is it Mr. Matthews? Mr. Matthews?
It is, yes. Morning, Doctor. Good morning.
I'm the medical registrar on call today at the hospital,
right.
and I've just read the letter that your GP sent earlier.
Yes.
He's been saying you've been having some problems with chest pain.
I have, yes, and this last week has been particularly bad. And I went down to him this morning, and he sort of said, "Well, I'll give you a letter and get down to hospital if you're capable." So it's actually cleared at the moment, but it has really been bad this week.
So just tell me about this pain you've been having in your chest. When did it all start?
Well, I mean, it's been on and off for about, I suppose about 4 months now.
Okay.
And as I say, it's just this last week that's really got bad. But, I've sort of, it's in the middle there,
It's in the centre of your chest. And what does it feel like when you get it?
Oh, well, I suppose it's sort of like something pressing down, sort of, crushing, almost a weight on my chest there. And as I say, until recently it's sort of been 3-4 times a week, which hasn't been too bad, but this last week has been much worse, so
and how long does the pain last for? Does it
hard to say really, 10 maybe 15 minutes, something like that. Feels longer, but I think it's I think it's no more than a quarter of an hour.
And is there anything you can do that helps to get rid of the pain?
No, I mean, I've not taken any painkillers or anything. I just try and sit quietly and let it go. And I learned a while ago that it does clear up, but so I just try and take things quietly.
Okay. And does it radiate anywhere? Does it go into your neck, into your arm?
You mean anywhere? No, it's always in the same place. It's always in that same place there. Yeah.
And tell me, do you feel out of breath when you get it, or sweaty?
I do sometimes.
Or
Yes. I suppose yes. I do feel a bit clammy actually, and sometimes I do. I do get quite breathless with it actually. I mean, I think I'm partly bringing it on myself actually. I think I get a bit panicky if I feel it coming on.
Do you notice your heart racing at all when you get it?
Not particularly,
Okay.
no, I don't think so.
Okay.
No.
Fine. Just a few other questions. Do you have any other medical problems? Do you have, for example, high blood pressure?
Yes, I do, but I've got tablets for that.
Oh, right, okay.
What are they called? Ramipril?
Ramipril, that's
something
right,
like
yeah.
that. Just have one a day of those.
Do you know what dose that is?
It's well, I'm not sure. 10 with it, maybe.
It may be 10 milligrams.
10 milligrams.
That could be right. We'll have a look at your medication later.
Yeah. If I remember to take them, I must confess I'm not as good as I might be. That wouldn't be making the pain worse or anything?
Not necessarily. I mean, do you take any other tablets? Or are you on any other tablets for any other conditions?
No, I mean, I've got diabetes, but that's a diet thing. Is it what they call type 2, I think? Right, okay. I've only had that about 6 months, and I've got to just watch the diet for that.
Right, okay,
yeah.
Fine. And do you smoke at all?
Yes, I do. I know what you're going to say, but yes, I do actually. Mm-hmm. Yeah.
And how many do you smoke?
About 40 a day, if I'm honest with it. I know it's not a good thing for me, but I've smoked since late teens, and I mean, I've never been able to give it up really.
Okay, and alcohol? Do you drink?
Not too bad. No, I'm not a heavy. I mean, I do enjoy a drink, but I wouldn't have said I was too heavy at all with it. Yeah, 2, maybe 3 bottles a week, the most. Yeah.
And do you have any problems with cholesterol? Has anybody mentioned problems with cholesterol in the past?
Not that I know of at all. No,
okay.
no. I'm not sure it's ever been checked actually. No.
And who's at home with you?
It's the wife actually. Well, I mean, I'm a bit worried about her because she's suffering from dementia actually. She varies from day to day. I've got a neighbour with her actually, so
she's looking after her, is she?
I'm not going to be too long here actually.
Okay, fine.
Yeah.
So you're really the main carer, are you, for your
I am,
your
yes,
wife?
yes, I am now these days. Yes, I took early retirement actually, so I could look after her.
Do you have any support at home for that?
Not a great deal, no. I mean, there's sort of nurse looks in from time to time, but I cope all right. But it can be difficult at times.
And is there anything that runs in the family? Is your parents have any medical conditions? Or?
Well, I mean, my mum died she from a stroke, and my father had a heart attack quite a few years ago now.
How old was he? Do you know when he had?
When the heart attack, about 50, I think, something like that.
Right. Okay.
My mum was 64 when she died. Yes.
Okay. Fine.
Same age as I am, I suppose.
Well, if it's okay with you, would it be all right if I just examine you briefly now?
Sure, yes.
Okay, just have a listen to your heart and so on.
Okay.
I'll just take your pulse a second if that's okay. Okay, that's fine. And if you can just turn your neck just slightly to the side, that would be great. Okay, that's fine. You can put your neck back, and I'm just going to feel for your heart now.
Okay, you have 2 minutes remaining.
Deep breath in, and out, and hold it. Good, that's fine, and breathe away. If you could just sit forward for me a second, sir. Just going to have a look at your back. Nice deep breath in and out for me. And again. Okay, and you can just sit back again for me. Put your head up there, that's great. And I'm just going to have a look at your ankles now as well. Any pain in your ankles at all?
No, no.
Okay. Okay, that's great. Thank you very much. Okay, Mr. Matthews, do you have any questions or any concerns?
Well, yes, I mean, apart from this problem, I'm also worried because, like I said, my wife suffers from dementia and there's a neighbour sitting with her, but I did say I would be back home as soon as possible, you know. It's not going to take too long, is it at all? I will be able to go home today.
I think what we need to do is get to the bottom of what's causing the chest pain.
Yes.
Now, you had some blood tests when you first came into the hospital. One of those will be looking at, you know, specifically your heart. So we're going to hopefully have that result back in the next couple of hours. I'd also like to get an X-ray of your chest and perform an ECG on you to have a look at your heart rhythm.
Right.
If that's okay with you.
It won't take too long, though.
Those won't take too long, no.
Okay.
And once we've got the results of those, and hopefully if they're okay, you will be able to go home. But obviously we need to wait and see what the results show first.
Okay, well, as long as it's not too long, as I say, because it is worrying, you know.
Okay, no problem. Well, we'll get the results for those, and I'll come and speak to you as soon as we've got the results back.
Oh, thank you, Doctor. Thank
Okay,
you.
no problem.
So what is your diagnosis for this patient?
This gentleman gave a history of probable ischemic heart pain, and I was particularly worried that he may be developing unstable angina, given the symptoms that he reported to me previously.
And how would you investigate this patient going forward?
I think that, initially for this gentleman we would want to admit him for assessment, perform ECG. I'd like to know his troponin as well, given that he had a recent episode of chest pain. Pending these results, I'd then probably want to do further investigations if there was any evidence of ischemic heart disease. So, for example, echocardiogram, and then further cardiological investigations if required.